Welcome to the Deep Dive. Today we're tackling a really charged issue hitting America's healthcare system. Think about this. 14.3 million Americans on Medicaid in 2024 under scrutiny.
And why? Well, estimates suggest maybe 10, even 15% might misuse substances.
Which leads directly to this huge question. Should we actually require periodic drug screening for people to get Medicaid?
It's a massive debate. And it's not just policy, is it? It touches on healthcare access, social welfare, individual rights.
Absolutely.
So our mission today is to, cut through some of the noise. We want to look at where this idea came from, the arguments on both sides, and what the long-term fallout might be.
Right. Does it genuinely tackle abuse, or does it maybe just make existing inequities worse?
Exactly. We got some good data points and history to look at, so we'll try to help you, the listener, navigate this complex landscape.
Okay, so let's dig in. This idea of drug testing for public aid, it's not new, right? It has pretty deep roots.
No, not at all. It really started gaining steam back in the 1990s with all the welfare reform talk. Remember the Personal Responsibility and Work Opportunity Act?
Vaguely, yeah. Part of that bigger push for accountability with public money.
Precisely. And then you saw states like Tennessee, Michigan doing these early pilot programs for general welfare, mostly based on anecdotal stuff, stories of misuse.
But Florida's attempt in 2011 feels like a key moment. They tried to mandate tests for TNF recipients.
Right, temporary assistance for needy families. Their argument was deterrence, stopping misuse before it happens.
And how did that play out? Because I remember it didn't quite go as planned.
Not exactly. A federal court in 2014 actually struck it down, called it unconstitutional, a pretty major ruling.
Okay, so unconstitutional for TNF. But the idea didn't die. You're saying it resurfaced, specifically for Medicaid, around 2023.
Yeah, it gained new momentum. You had Republican lawmakers, Senator Rand Paul was one prominent voice, proposing to link Medicaid eligibility directly to being drug-free.
So why the shift to Medicaid? What's driving that specifically?
A big part of it is concern over fraud. There was a 2022 study estimating, get this, $1.2 billion in annual Medicaid fraud.
Wow.
And they linked a significant chunk of that to substance abuse.
So the target becomes Medicaid's huge pool of enrollees, 83 million people? A population where statistically poverty is high.
Right, about 30% below the poverty line. And the data does show slightly higher drug use rates, 12% in 2023, compared to maybe 10.1% nationally. It's a difference, but maybe not as dramatic as some narratives suggest.
Still, the proposal could potentially affect, 1 to 2 million people losing coverage based on tests that cost $10 to $50 a pop.
Correct, depending on whether it's urine, hair, saliva.
Yet there's undeniable public backing. That 2024 Gallup poll showed 58% support for testing for public assistance. It taps into that personal responsibility narrative.
It does. And it connects with broader anxieties about the opioid crisis, about welfare dependency. So you see states looking for federal waivers to try and implement these kinds of tests.
Okay, so let's unpack the arguments for doing this. Proponents see it as what? A fiscal necessity, a moral one.
Both, really. They argue it directly tackles systemic abuse, that 2023 fraud estimate we mentioned. They pinpoint about $300 million of that specifically to substance-related overbilling within Medicaid itself.
So it's about saving taxpayer money.
That's a huge part of it.
Yeah.
Senator Paul's argument, and others like him, is basically taxpayers shouldn't be funding health care for people unwilling to stay drug-free. It's framed as common sense, fiscally and morally.
And do they have evidence it actually works as a deterrent?
Well, they often point to that 2021 Tennessee pilot for TNF. It showed about a 7% positive test rate.
Okay.
And that was followed by a 5% drop in enrollment. Proponents look at that and say, see, it discourages misuse.
Interesting. So the idea isn't just stopping fraud, but maybe pushing people away from the program if they use drugs.
Or potentially redirecting the funds. The argument goes if we screen people, we can take some of Medicaid's massive budget, $800 billion in 2024, and put it towards treatment instead.
Are there examples of that happening?
They might cite Kentucky. In 2023, after putting in similar measures, they allocated $50 million for rehab facilities. So the idea is shifting money from perceived abuse to actual addiction solutions.
And there's another angle too, right? Incentivizing sobriety.
Exactly. You have about 2.1 million Medicaid enrollees who reported using opioids in the past year. The hope, for proponents, is that testing pushes them towards rehab.
Which could theoretically lower long-term healthcare costs. Those are huge, something like $78 billion a year just for substance-related care.
That's the economic argument. They even draw parallels to the private sector. There was a 2022 SHRM study Society for Human Resource Management.
Uh-huh.
It found pre-employment drug screening cut absenteeism by 15%. So they suggest maybe this could work similarly in the public sector.
So it taps into this cultural feeling, too. I've seen things online like that X post you mentioned from @Taxpayer Voice. Why should my taxes pay for someone's drug habit? Test them. It resonates with a certain segment of the public.
It definitely does. But then you have the arguments against it, which are just as strong, if not stronger, in some areas.
Okay, let's hear the flip side. What are the main criticisms?
Effectiveness is a big one.
Mm.
Critics say it just doesn't work well and it's discriminatory. Go back to that Florida T and F case from 2014.
Right, the one struck down by the court.
The court found only 2.6% of applicants actually tested positive. That's way lower than the 10% they assumed. And it cost the state $118,000 just for the testing.
So a lot of money spent for very few positive results.
Exactly. And a 2023 ACLU report on Michigan's program found an even lower positive rate, 1.5%. It really calls into question whether that 12% misuse estimate for the whole Medicaid population is accurate or maybe inflated for the purpose of this argument.
Which leads to the cost-benefit analysis, doesn't it? If you test everyone, all 83 million people, the cost could be astronomical.
Potentially $1 to $2 billion a year. Critics argue that cost plus administrative overhead plus the inevitable legal fights, it could easily swallow up any savings from denying coverage.
So it might actually cost taxpayers more in the long run.
That's the concern. And then there are huge equity issues.
How so?
Well, Medicaid disproportionately serves low-income minority groups. About 40% of recipients fall into that category.
Okay.
Critics worry about the stigma of drug use, but also about actual testing disparities.
Mm-hmm.
There's NIH data from 2022 suggesting Black individuals have a 20% higher rate of false positives on some tests.
Wow, that's significant. So the policy could end up disproportionately hurting the very people it's supposed to help, or at least not hurt.
That's the fear. Denying essential health care based on potentially flawed or biased testing.
And what about privacy? That seems like a major hurdle.
A huge one. The Fourth Amendment argument against unreasonable searches was central to the 2014 Florida ruling. Forced testing bumps up against that, and potentially IPA privacy rules, too.
Right, the Health Insurance Portability and Accountability Act.
You have figures like Senator Bernie Sanders arguing very strongly that this isn't about tackling abuse, it's about punishing poverty.
His point being that most drug users aren't actually on public aid.
Yeah, he cites stats suggesting 70% of users are employed. It fuels that counter-narrative you see online, too, like at Justice for All, saying it's a war on the poor, not drugs.
There was also that RAND study you mentioned earlier. What did it find about actual drug use versus enrollment?
Right. The 2021 RAND study, it found that testing policies did deter people from enrolling in aid programs.
But not necessarily from using drugs.
Correct. Many people apparently just opted out of getting help altogether rather than face testing or seek treatment tied to it.
Which could backfire spectacularly.
It could. More untreated addiction could mean more emergency room visits, more uncompensated care that hit $13 billion in 2023. It suggests maybe the focus is wrong.
Meaning
Maybe focusing on testing, the sort of punitive approach, misses the root causes, like maybe we should be expanding mental health services or addiction treatment access. CMS data from 2024 suggested those services are underfunded by about 30%.
So testing becomes a sort of surface-level fix that ignores deeper issues.
That's the core of the critique, yes.
Stepping back a bit, this whole debate doesn't exist in a vacuum, does it? It feels connected to older arguments about welfare.
Absolutely. You could draw a line from the sort of welfare queen stereotypes of the 60s through the 96 welfare reform right up to this. There's a recurring theme of suspicion towards public aid recipients.
And Medicaid itself has become a bigger target, especially after the Affordable Care Act expanded it.
Definitely. The ACA brought in, 12 million more people. Costs have been rising about 6% annually. That makes it a prime target for cost-cutting measures in political debates.
And the opioid crisis must play a role in intensifying the scrutiny.
Tragically, yes. 80,000 lives lost in 2023 alone. And the fact that 15% of deaths among Medicaid recipients were linked to overdoses just puts the program under an even brighter, harsher spotlight.
You also see a real split between states, right? Red states versus blue states?
Generally, yeah. Republican-led states, which control about 22 Medicaid programs, are often the ones pushing for testing waivers, framing it as fiscal responsibility.
While Democratic-led states tend to push back.
They tend to resist, yeah, usually citing civil liberties, the equity concerns we talked about, the potential for harm.
So this isn't just theoretical. It's playing out in state legislatures and potentially in Congress right now.
Very much so. The 2025 federal budget talks, with $900 billion proposed for Medicaid, really bring this to the forefront. And you have states like Ohio, Missouri, with waiver requests currently pending. It's an active battleground.
Okay, so looking down the road, what are the potential long-term consequences if policies like this become more widespread? Let's start with the social impact.
Well, the most immediate concern is probably widening health disparities.
Hmm.
If you deny coverage to potentially 1 or 2 million people,
You're going to see the uninsured rate tick up. It's already 8.6% in 2024.
and it would likely hit minorities harder, given that 25% rely on Medicaid.
Beyond just losing coverage, what about the stigma effect?
That's a real worry. Could it deter people who are eligible from even applying? KFF data from 2023 suggested there are already 5 million people eligible for Medicaid, but not enrolled. Testing could scare more away,
Leading to less access overall?
and potentially straining community health resources more broadly. If untreated addiction rises, you could see knock-on effects on crime rates. Some states that implemented testing did report increases in drug-related arrests, around 10%.
Okay, what about the economic side? Are the savings real?
Highly uncertain. That 2022 CBO estimate suggested maybe $500 million in annual cuts.
Which sounds like a lot, but
But when you factor in the billion-plus dollars testing could cost, plus lost productivity from people losing healthcare access, remember Florida's 3% unemployment spike? The net effect is really debatable.
and the idea of redirecting funds to treatment, does that hold water?
It could lead to more treatment funding, yes. But the system is already struggling. Only about 10% of people with addiction currently receive care. So, unless there's a massive simultaneous investment in robust rehab programs, just screening people might not move the needle much on workforce health or GDP.
Makes sense. What about the legal and political future? More court battles?
Almost certainly.
Yeah.
That 2014 Florida ruling, the ongoing ACLU suit in Michigan, they strongly suggest this is headed for more legal challenges, possibly even the Supreme Court by, say, 2027.
And politically, it sounds like a wedge issue.
Definitely polarizing. You have that 62% support in the Gallup poll, but also 35% strongly opposing, according to Pew. It's the kind of issue that could really mobilize voters and potentially shape elections like the 2026 midterms.
So any chance of compromise seems slim.
Based on the current climate, yeah, finding bipartisan common ground on this looks tough.
Fine, what about the sort of cultural shift? What could this normalize?
Well, there's a concern it normalizes more surveillance in public life, especially for aid recipients. Could it bleed over into food stamps? Housing assistance?
Slippery slope argument.
Potentially. It could also reinforce that old, problematic narrative of the deserving versus undeserving poor. That might subtly erode support for broader concepts like universal health care, which, according to a 2025 Harris poll, about 44% of Americans actually favor.
Is there any potential upside culturally? Like raising awareness?
Theoretically, yes, if it were paired with serious public education campaigns about addiction as a health issue. But that doesn't seem to be the focus of the current policy pushes.
Yeah.
They're mostly focused on the screening itself.
Okay, so bringing it all together, when we really analyze this, it seems the narrative driving the policy widespread abuse unique to Medicaid recipients might be, well, shaky.
The data suggests it's at least overstated. That 10–15% misuse estimate, while obviously concerning, isn't wildly out of line with the general population. It makes you question if Medicaid recipients are being unfairly singled out.
And does focusing on testing distract from bigger, harder problems?
That's a strong argument from critics. You know, the lack of addiction specialists in rural areas, underfunded mental health services. Is testing an easier political target than tackling those systemic failures? A kind of scapegoat?
And we have to acknowledge the biases, right? Racial, economic.
They absolutely amplify the issue. Testing policies, intentionally or not, are likely to hit marginalized communities hardest, echoing historical patterns of discrimination and welfare.
So the big picture seems to be that real long-term solutions probably need to address root causes, poverty, lack of opportunity, mental health care access, not just the symptom of drug use.
Exactly. And that broader perspective often seems missing from this specific debate about drug testing.
So for you, the listener, what's the takeaway here? This debate over drug testing for Medicaid boils down to a fundamental conflict: fiscal concerns versus equity and access.
You have arguments about taxpayer responsibility, about tackling that $1.2 billion fraud figure, about nudging people towards sobriety. Those are powerful arguments for proponents.
But on the other side, you have serious questions about effectiveness. Those low positive test rates, the high costs, plus major legal hurdles, privacy violations, and the real risk of worsening racial disparities.
The long-term impacts are really unknown, but could be significant, from higher uninsured rates to shifts in political alignment and maybe even cultural attitudes towards surveillance and poverty.
Which leaves us with that provocative question to chew on. As we stand in 2025, does pushing for Medicaid drug testing genuinely address substance abuse effectively? Or does it risk creating deeper divides in our society?
It's a complex calculation with no easy answers.
And if you find these kinds of complex issues fascinating and you want to keep exploring the forces shaping our world, definitely check out Mind Expansion Daily. You'll find more great information and deep dives just like this one.
Yeah, it's a great resource.
And while you're there, please remember to like and subscribe to Mind Expansion Daily. That way, you won't miss out on any future insights. Thanks for joining us on the deep dive. We'll see you next time.